What's up, ladies and gentlemen? Welcome back to Neuro Sketch with Dr. Kenny. But if this is the first time seeing this channel, don't forget to subscribe. Today we're going to discuss about the dural venous sinuses, but before we dive into details, let's have a quick recap on the meninges. We said we have three layers of the meninges, and the outermost layer is called the dura mater, and the word dura means hard. Now, the dura mater has got two layers, the periosteal layer, which is adherent to the bones of the cranial cavity, and the meningeal layer, which is close to the other meninges. And these two layers are in contact with one another, but at times, the meningeal layer of the dura mater is splitting away from the periosteal layer of the dura mater, creating a space in between, and this space is called a sinus. Now, a sinus, the word sinus actually means a cavity, hollow, or a bay. But what is the venous sinus now? Mean this sinus is carrying a venous blood. This sinus is carrying a venous blood. Now, what could be the dural venous sinus? The dural venous sinus simply means that we have a cavity within the dura mater, the cavity within the dura mater which is holding the venous blood, and that's your dural venous sinuses. Now, if we define the dural venous sinuses, we're gonna say these are the group of sinuses that are carrying the deoxygenated blood or the venous blood from the cranial cavity back to the circulation, back to the cardiovascular system by the way of the internal jugular vein, Where are these dural venous sinuses located? They are found between the two layers of the dura mater, and that's going to be your periosteal layer and the meningeal layer of the dura mater. So what are the differences between the typical veins? Now, the dural venous sinuses, despite the fact that they are holding venous blood, they are not veins. They are not typical veins, and they differ in the following manners. Number one, they do not have the tunica media, and they also devoid of the smooth muscles. They do not have the tunica media and the smooth muscle. These dural venous sinuses, unlike veins. Veins have tunica media. They also have the smooth muscles, but also they have no valves. They are valveless. These dural venous sinuses, they are valveless, unlike veins. And on top of that, because their walls are enhanced by the dura mater, these veins do not collapse. These sinuses do not collapse. Why don't they collapse? Because their walls are very rigid. Why rigid? Because they are enhanced by dura, and the word dura means hard. Yes, and also they act as a reservoir of venous blood. What is the function now of these sinuses? Because they are holding the venous blood, yes, one among the functions is they are carrying this venous blood back into circulation by the way of the internal jugular vein. They are carrying it back to the cardiovascular system by the way of the internal jugular vein. Another important function about of this dural venous sinus is that they are carrying the cerebrospinal fluid back into the venous system. Remember, we said the cerebrospinal fluid is circulating in subarachnoid space, and then this at some point we said is going to be absorbed into the venous system, into the sinuses of the brain, right? Now, these sinuses are the dural venous sinuses, and the fluid from arachnoid space is brought to the dural venous sinuses by the way of these structures here, and these structures are called the arachnoid granulations. Going to drain the cerebrospinal fluid back into the veins, and is going to the circulation, and the cycle continues. Now, we have a lot of these veins, but a lot of these sinuses, but the major ones are 7, and these are the major sinuses. Don't worry, we're going to discuss each one in turn. And then most of these sinuses, they are adjacent to the falx cerebri and the tentorium cerebri. Now, this is a snapshot of the sinus that we're going to discuss today. We have the superior sagittal sinus. It is sagittal because it's in sagittal plane, but superior because we also have inferior sagittal sinus. And this is the inferior sagittal sinus. But we have a sinus which is straight, and it's called the straight sinus. This is a straight sinus because it's straight. We have a sinus which is running in the transverse plane, and this sinus is called the transverse sinus. We have a sinus in the occipital bone, and it's called the occipital sinus. We have a sinus which is S-shaped, and because of S-shaped, it's called the sigmoid sinus. We have two sinuses that are called the petrosal sinus. We have superior petrosal and inferior petrosal sinus, and the superior petrosal because it is running in the superior petrosal groove, and inferior petrosal is also running in the inferior petrosal groove. We've also seen the the cavernous sinus, but you cannot see the cavernous sinus from this picture. But don't worry, I'm going to discuss each one in turn. Let's start with the superior sagittal sinus. Now, the superior sagittal sinus is superior because we also have inferior, but sagittal because it's running the sagittal plane. It's running on the sagittal plane. The superior sagittal sinus is running all the way from the crista galli anteriorly, running in this superior sagittal sinus is running all the way to the conference of sinuses posteriorly, and this conference of sinuses is located at the internal occipital protuberance. If you guys remember, we said also the pharynx cerebri is attaching anteriorly from the crista galli, and posteriorly is running posteriorly to the internal occipital protuberance, point of attachment. Now, the superior sagittal sinus also travels almost the same distance to attach to drain blood. So it drains the blood into the conference of sinus, which is located posteriorly. Did I mention about the conference of sinus? Okay, if I didn't mention, the conference of sinus is this point where a lot of sinuses will meet, a conference, like a conference of sinuses, and it's found here posteriorly, and is located at the internal occipital protuberance. Now, your superior sagittal sinus is going to empty blood into the conference of sinus. And then the superior sagittal sinus has out pocket they have like extension. The superior sagittal sinus has extension lateral, and this extension are called the lateral venous lacuna. Lateral venous lacuna are the extension for your superior sagittal sinus. We have only one superior sagittal sinus. Now, because of superior, we also have inferior. So let's discuss about the inferior sagittal sinus. This is the inferior sagittal sinus, and the inferior sagittal sinus is running on the free border of the pharynx cerebri. The superior sagittal sinus is running on the upper border of the pharynx cerebri. Now, the inferior sagittal sinus is running on the inferior border or the free border of the pharynx cerebri. Now, it's going to drain its blood into this sinus here, which is called the straight sinus. This is a straight sinus, and the inferior sagittal sinus is going to empty its blood to the straight sinus. Now, what is this straight sinus? Now, the straight sinus, this is a straight sinus, and the straight sinus is also called the rectus, sinus rectus, because the word straight is translated in Latin as rectus. So rectus, sinus rectus also means straight sinus. Now, the straight sinus will receive blood from two important systems. Number one is the inferior sagittal sinus. The inferior sagittal sinus is going to empty blood into the straight sinus, and also the great cerebral vein, also called the cerebral vein, the vein of Galen. The great cerebral vein, also called the vein of Galen, is going to join the inferior sagittal sinus to empty blood into the straight sinus. Then where does this straight sinus empty blood into? The straight sinus receiving blood from these two systems, and then it's empty this blood into the conference of sinus here. This is the conference of sinus. So let's now discuss about the conference of sinus. The conference of sinus in this point here is dilated in the internal occipital protuberance. We've already said the location of the conference of sinus, internal occipital protuberance, but this one receives blood from, number one, the superior sagittal sinus, drains blood directly to the conference of sinus. We have just seen the straight sinus is draining blood into the conference of sinus, and lastly, we have a vein here, which is called the sinus here, which is called the occipital sinus. Down here, occipital sinus also drains to the conference of sinus. So we have three unpaired sinuses that are draining their blood into the conference of sinuses. Number one is the superior sagittal, the straight, and the occipital sinus. Now, this is the coronal. This is the horizontal view of these sinuses. This is the conference of sinus, and you see it receives the blood from the straight. It's receiving blood from the straight sinus, also from the superior sagittal and the occipital sinus. And also now this blood from the conference of sinus is going to be drained away from the conference of sinus by the way of the transverse transverse sinus. Are you ready now to discuss about transverse sinus? Yes, let's discuss about the transverse sinus. Now, this is the transverse sinus. The transverse sinus is draining blood from the confluence of sinus, and it's going to empty this blood into the sigmoid sinus. The transverse sinus is going to drain this blood from the confluence of sinus all the way to the sigmoid sinus. We have two transverse sinuses, one on the right and one on the left, and by far we've seen unpaired branches, unpaired sinuses. We've seen the inferior sagittal, the superior sagittal, and the transverse. All of these were unpaired, and this was occipital sinus is also unpaired, but the transverse sinus is paired. One on the right and one on the left, and it's going to empty blood into the sigmoid sinus. We have two sigmoid sinuses, one on the right and one on the left, and the sigmoid sinus is following the next one. This is your sigmoid sinus, and the sigmoid sinus is receiving blood from the transverse sinus. The sigmoid sinus is receiving blood from the transverse sinus. Sorry, I haven't mentioned, but the transverse sinus sometimes also, not sometimes, the transverse sinus receives blood also from this vein. We're going to discuss also about this sinus, but it also drains blood to the transverse sinus. Now, the sigmoid sinus receives blood from the transverse sinus, and we have just said the word sigmoid because this one is S-shaped. It's called sigmoid. Now, the sigmoid sinus, once it receives its blood from the transverse sinus, is going to go through the foramen, for a jugular foramen, and once it crosses the jugular foramen, it changes name from the sigmoid sinus to become the internal jugular vein. Now, the internal jugular vein is a continuation of the sigmoid sinus once it punches the jugular foramen. Once it goes to the jugular foramen. Now, we have these two veins here. These two veins, we have said, we have the superior petrosal sinus and the inferior petrosal sinus. Now, the superior petrosal sinus is called superior petrosal because it's running through the superior petrosal groove, and this is also inferior petrosal because it's running from the inferior petrosal groove. But both the superior petrosal and inferior petrosal, they are draining blood from the cavernous sinus. Now, this is the superior petrosal sinus. It's draining blood from the cavernous sinus and going to empty this blood to the transverse sinus. See, this is a transverse sinus. This is a superior petrosal, and this is cavernous sinus. Now, the cavernous sinus is being drained partly by the superior petrosal sinus, and this blood is going to be emptied to the transverse sinus, and we know the transverse sinus will empty this blood to the sigmoid, and the sigmoid will go through the jugular foramen to become internal jugular vein. Now, because of the superior petrosal, we also have inferior petrosal, and this is your inferior petrosal sinus. Now, the inferior petrosal is also draining blood from the cavernous sinus. It's draining blood from the cavernous sinus, but unlike superior petrosal, the inferior petrosal is emptying all the way directly to the internal jugular vein. The superior petrosal we have seen, it is draining blood into the transverse sinus, but the inferior petrosal, is draining blood directly to the jugular vein, into the internal jugular vein, and so it goes through the jugular foramen as well. You guys ready to discuss about the cavernous sinus? This is very, very important. The cavernous sinus, the word cavernous means cavern or a cave, and because of these trabeculations, and the cave means like under the underground, those underground caves. So this is the cavernous sinus. Now, cavernous sinus is a large venous plexus which is found on either side of the sella tussica. Remember, we have the sella tussica here, and the sella tussica is found on the body of the sphenoid bone, and at the center of the sella tussica we have the apophyseal fossa where the pituitary gland sits, and this is pituitary gland. Now, the cavernous sinus is on either side of the pituitary gland or on either side of the sella tussica, and it is now, what is the location of the cavernous sinus? It is lateral on either side of the sella tussica, but it is medial to the temporal bone, on either side. Let's see the relationship with the pituitary gland. This is the pituitary gland sitting in the apophyseal fossa, and this is gonna be your cavernous cavernous sinus, and on either side of the pituitary gland on the ceratosica, and this is your sphenoid air sinus. What are the main veins that are draining into the cavernous sinus? What are the main tributaries of the cavernous sinus? The venous system that are emptying their blood into the cavernous system. Number one is going to be your superior ophthalmic and the inferior ophthalmic vein. This is very, very important because you see the superior ophthalmic vein is communicating with the face. Now, infection from the face can spread into the cavernous sinuses by the way of these veins, the superior ophthalmic and the inferior ophthalmic veins. This is very, very important and a clinical note. But also, we have the sphenoparietal sinus, which is running on the in the upper border of the lesser wing of the sphenoid bone. Is going also to drain its blood to the cavernous sinus, but also have another vein here which is called superficial middle cerebral vein. It's also emptying blood into the cavernous sinus. Is this very important? Well, yes, maybe or maybe not. And then let's see how this blood is drained, is carried away from the cavernous sinus. Now, blood from the cavernous sinus is going to drain to superior petrosal sinus. We have seen the superior petrosal sinus, and we've said it drains the cavernous sinus, and the superior petrosal is going to empty blood into the transverse sinus. One more time, we've also seen the inferior petrosal sinus, and we've said the inferior petrosal sinus is draining blood from the cavernous sinus and directly into the internal jugular vein. It's going to the internal jugular vein, and because we have the cavernous sinus on the other side, they will have communication between the cavernous sinuses. This communication is called the intercavernous sinuses. We have anterior and the posterior intercavernous sinus, and then we also have this plexus of veins here, which is called the basilar plexus. Maybe they're not very relevant at this point, maybe. Now, what is so important to discuss is the contents of the cavernous. This is very, very important to discuss. And now, what are the contents of the cavernous sinus? Number one is going to be the internal carotid artery. This is the internal carotid artery. This is the internal, and this is the internal. It's because it's looping, it's looping around. And when you cut through the coronal plane, you're going to see the two internal carotid arteries, but it's actually one which is looping around one another. And what are the veins? What are the nerves? This is very, very important. Pay much attention here. Cranial nerve number 3, number 4, number 6, the first branch of trigeminal and the second branch of trigeminal, they are all located within the cavernous sinuses. What are the nerves? Cranial nerve number 3. This is number 3, number 4, number 6. The first branch of number 1, the second branch of number 2. The nerves are almost similar to the nerves that are passing through the superior orbital fissure, except the second branch of trigeminal nerve, which is maxillary nerve, which is maxillary nerve. All these four, they are passing through the superior orbital fissure, right? And remember, the cranial nerve number 3, number 4, and number 6, they are associated with movement of the eyes, because they are supplying the exocrine muscles. So if you have damage to these nerves, you have troubles with the eyes movement, and you're going to have paralysis of the eye movement, and it's called ophthalmology. This is very important because we have a condition which is called the cavernous sinus thrombosis. The cavernous sinus thrombosis actually means clot which is formed within the cavernous sinus. So one among the important etiology, one among the important reasons for why we have clotting of blood within the cavernous sinus is infection from the face. And we have said infection from face can spread to the cavernous sinus by the way of these veins which are connecting with the veins of the face. Now, this condition is called cavernous sinus thrombosis. It's very, 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 very life-threatening. It's very dangerous. It can be life-threatening. And this is a person who has a cavernous sinus thrombosis. It is septic inflammation, the septic formation of clot within the cavernous sinus. Okay. So what are the symptoms? What are the presentation of your patient? It's going to be fever, fever, ophthalmoplegia, paralysis of extraocular muscles. And we have paralysis of extraocular muscles because we've said most of the nerves that are going to supply the extraocular muscles are found within the cavernous sinus and can be inflamed, but especially number 6, because number 6 is surrounded. We're going to discuss also again about the cavernous sinus at some point, but number 6 is because it's deep within the cavernous sinus. Let me show you once more here. Number 6, this is cranial nerve number 6, is deep within the cavernous sinus. So if we have like increase the pressure here, it's gonna be compressed on either side. Unlike the other ones which are found on the on the walls, they can only be compressed on one side. But this number 6 is compressed on either side, and it is very vulnerable to cavernous sinus thrombosis. And this is why we say especially number 6, cranial number 6, which is called abducens, the abducens nerve. Now this region of the face, which is drained by these vessels into the cavernous sinus, is considered the dangerous triangle of the face. This is the danger triangle of the face because infection from here can spread to the cavernous sinus and can result into formation of clots, and that clot, you said, is called the cavernous sinus thrombosis. Cavernous sinus thrombosis, which is life threatening, and it's very dangerous. And if you have pimples located on this region, it's very it's very tricky to remove them because it can result into cavernous sinus thrombosis and life threatening, very dangerous situation. I made a little summary for you here on the sinus, on the venous sinuses. You can all pass through at your own material time. All right, folks, it was just a simple discussion of the cavernous sinus. If you have question, additional comments, write your comment section. But don't forget to like and share this video to your friends, and see you very soon.